This video is an introduction to the topic of antipsychotics. I will discuss some basic concepts on terminology and general pharmacology of this class of drugs. After this lecture, you will be able to first describe the meaning and history of the terms neuroleptic, neurolepsis, and atypical antipsychotic, and second, describe the main differences between first and second generation antipsychotics. I'd like to clarify some terminology first. The terms neuroleptic, typical, and atypical are commonly used in practice. It is interesting to understand their background and meaning. First, what is a neuroleptic? This is a term used to refer to first-generation antipsychotics, such as chlorpromazine or haloperidol, because of their ability to produce neurolepsis. The question that follows is, what is neurolepsis? Clinicians in the 50s described the syndrome, which has three main features: psychomotor slowing, emotional quieting, and affective indifference. Clinicians at the time thought this syndrome was a reliable sign of antipsychotic efficacy. But nowadays it is clear that these effects are not required for drugs to have therapeutic action, and also that the presence of these symptoms predicts low treatment adherence. What is an atypical antipsychotic? Originally, this term was used to describe a lower risk of extrapyramidal symptoms associated with clozapine use. Researchers found that at therapeutic doses, clozapine showed a much lower risk of extrapyramidal symptoms, such as tardive dyskinesia. Later, the use of this term was broadened to include efficacy against negative and cognitive symptoms, lack of prolactin elevation, and efficacy in treatment-resistant patients. Currently, researchers argue that the addition of the features shown here in green have hampered antipsychotic drug research, and that reframing the concept of atypicality could have a key role in the advance of this field. Let's see this table to review the concepts we just discussed. On the left, I have listed the classic and commonly used terms. On the right, the new terminology proposed by the World Psychiatric Association. Neuroleptics, as we discussed, are the drugs that fall under the category of conventional antipsychotics or typical antipsychotics. The new terminology calls them first-generation antipsychotics. These include drugs such as chlorpromazine, haloperidol, flufenazine, among others. The term atypical antipsychotics is the most commonly used for second-generation antipsychotics. Based on their shared pharmacological properties, these drugs are also called dopamine-serotonin antagonists. Drugs that act as dopamine partial agonists fall under the third-generation antipsychotics category. Currently, the only FDA-approved drug in this group is aripiprazole.